happy Friday, and thanks for tuning in to radiofreerhinecliff.org and the show in particular. Correct me if I'm Norm. I'm your host, Norm. I'm thrilled to be here tonight with Marybeth Cale and Dr. Amy Novatt. Thanks for being here, both of you.
Thank you for having us. What a lovely way to kick off the weekend.
So good. Thanks for bringing a bottle of wine. It's really, really delicious.
But of course.
Thank you. Let's just start off by saying, why are you two here?
You know, we had nothing else going on, so we thought we'd come down to Rhinecliff
You saw
and
the
hang
flyer
out
at
with the
CVS.
Exactly, the famous Norm.
Oh, yeah, good.
Well, we're so excited. So, you know what I was thinking about as I was driving here this evening? I never really knew Marybeth. I mean, we literally are like new friends. We met, I don't even know, but I had heard her name, you know, throughout town and over the years, but we didn't overlap as parents in the school or anything like that. But I just knew you from afar. I thought you were beautiful and you seemed so kind and competent, but our paths just never crossed. And then one day, Norm, I don't know why, I think I reached out to you, or you reached out to me first to tell me about your new practice.
Correct. Inspired by your Gyno Curious podcast on Radio Free Rhinecliff.
There you go. And then we kind of became instant friends.
Yes.
Well, what new practice, Marybeth?
I had gone to pursue certification as a health and wellness coach, and I was trying to let people know about it. People who were in the medical profession who might have patients who would benefit from coaching services. And I listened to Amy on Radio Free Rhinecliff. And as she pointed out, despite living in a small town, it's amazing how you can go for many years and never cross paths with someone who many of your friends know, or who many of my friends went to as a doctor. So I reached out to her, and she graciously responded very quickly and said, let's get together for a cup of coffee. So coffee, and now we're having wine.
It's progressed quickly.
It's a good show.
Stick around.
It's
Hang out with me a little bit. We'll see how much we could drag you down. So you were cold calling
cold
medical
calling.
Professionals.
Yeah.
Saying, hi, Marybeth. What was your pitch?
I didn't have one, really. Just to introduce myself and let people know that I had just earned this designation as a National Board Certified Health and Wellness Coach, and I didn't really know exactly what my vision was, but I knew I wanted to support people. I had gotten certified as a life coach back in 2016, so this was really designed to round out my knowledge base and give me a little bit more confidence in terms of having something to offer. So I just felt like it would be a good idea to let the local medical community know about it in case they had patients who were recognizing that their well-being went beyond blood pressure and cholesterol and things like that, and wanted to work with someone who had a very basic understanding of health and wellness, but also had the tools as a life coach to help them clarify their goals and develop a vision for themselves.
Right. It's a nice 1-2 punch. So what does the certification for a health and wellness coach consist of?
So I attended a program through Mind Body Green, which, is just like any other online educational program. We had live, I don't know what you call it, synchronous classes when the professor is on, but you're on at the same time. Is that synchronous or asynchronous? I always got those two confused. And so I did that for, the better part of about 6 months, a few days a week, in addition to my regular work. And then I had to study for the board exams, which was not fun because I am no scholar. Study skills were never my strength. And doing something like that in midlife was even more difficult. But I got through it and I passed the exam. And so, like I said, it really just gave me a little bit more confidence, and it gave me a credential that might be meaningful for people with whom I work.
Right. So I'm guessing the exam has questions about, sort of physiological effects of different kinds of things, exercise, meditation, maybe drugs or...
To a degree, but it's really preparing someone to be a coach. And a coach is not the person who's giving any kind of advice when it comes to medicine at all. A coach is there to really facilitate the process of self-discovery inspire, motivate, support someone as they identify what action steps they need to take to thrive and optimize their own well-being. So the questions were really, there were some like that, I would say. If you ask me any of them now, I won't remember a thing. I even had to look up my own cholesterol to see just how elevated it was recently. But it's really more about understanding, how everything works together in life to promote well-being for someone.
Right.
So you look at the different life domains. I brought these wellness wheels in, which we're going to probably use on Thursday when we have our workshop, which Amy can talk about too. But, looking at life domains like physical health and energy, emotional and mental well-being, relationships and connection, rest, renewal, self-care, joy, fun, creativity, and kind of where you are in those various life domains, whether or not you might need to work on those areas and better align with those areas so that you feel your best. And then that sort of complements what's happening in the medical community in terms of taking care of the physical well-being, because it's all connected. And I think that's why Amy and I hit it off when we started talking over coffee one day, because we both appreciate that wellness is about overall well-being, and it can't be kind of siloed. You have to look at everything, right?
Well said.
So you cold called, and you, Dr. Novatt, called her back.
I did, or emailed her back. I don't remember how I responded initially, but yeah, I love meeting new people. And I, as Marybeth is speaking to, I so value someone who's looking at wellness in this really wide, integrative fashion. Because I was trained in a very conventional arena where it was about just blood pressure and cholesterol and evaluating heart disease from those perspectives, which is important. But what I've learned over the many years that I've practiced, that you can give folks all kinds of data, all kinds of medications, all kinds of conventional approaches towards getting better. But until they integrate it emotionally, even kind of spiritually, or even just logistically, how are they going to do their busy day and take their medications and take care of their kids and take care of their partner? Just kind of the way we feel so overwhelmed by our lives. How do I take care of myself in the face of that? And that's what Marybeth's work does so well. And certainly what I've tried to integrate into my practice over the years. Because, I could do so many pap smears, but if I haven't asked somebody how they're doing in their life, I'm only taking care of a small part of who they are.
So you had already been looking at sort of a broader, more holistic approach to treatment of your patients.
Yeah.
And you'd been doing that. And then Marybeth, very interested in this. She's a phenomenal salesman. Just her description, I'm like, here, take all my money, sign me up.
Are you going through menopause?
It's funny. It's funny you ask, because I want to read this. These are some of the symptoms of perimenopause: brain fog, memory problems, weight gain, especially around the belly, thinning hair, dry skin, joint pain, and fatigue. I'm like, fuck. Am I dealing with perimenopause?
It's called andropause in your case.
Is it?
Yeah. Yeah.
What the heck is that?
It's the phenomenon where there's hormonal changes in men. In their midlife, and that they see some of these changes as well. And
all of them.
For all of them.
Yeah.
There you go.
So back to the main thread here. Which part of Marybeth's her story, her sales pitch, which and because she's phenomenal at that, that's your other job, Cale Communications. Really resonated with you and made you think like, hey, wow, I'd like to see more of this or hear more about it?
Some of it's intangible. I think I was just in the right time and frame of mind, and I was pivoting in my own career and doing work that was more integrative and spending time with patients and less about surgery and procedures and pelvic exams. So part of it was, in a way, selfish. I wanted to hear about her work and vis-a-vis how I was looking at my own work. But two, I wanted to have a resource of someone who was going to look at life and wellness in a slightly different way.
Right.
I'm so, I'm unclear about a lot of things, but one thing I am clear about is that not everyone heals in the same manner. And that thankfully there are many ways in which to take care of oneself. And it may change for the individual over time, over aging, over problems, but it also is different for each of us as individuals. So I have a Rolodex of people whom I trust and value and respect, and who are doing work that's a bit different from me or very different from me. And I want to be able to provide those names and phone numbers and emails to my patients, because I can't take care of everything. I know I can't.
Right.
And so I think the best that I can do is say, you know what, I have someone who I think might be a really good fit for what's going on with you. And, it's a little bit like blind dating. I have no idea whether you guys will mesh or not.
Right.
But I just have a feeling, and then provide that information. So I was interested to know what Marybeth was doing. I was curious about who she was, because, again, I had, seen her across, bred alone and locally, but never knew her. And so I thought, oh, this is a good time to get to know someone new. And so it was just kismet, I guess.
I love that. And also, my idea, I don't think I'm wrong, it could be, is that many physicians, especially physicians, over, say, 50 or whatever, have a little bit of an attitude towards alternate modalities of healing. And we can call this one of those, I guess. And everything you're saying is like, no bad attitude, no nose turned up. You want to hear. You want to hear more of that, which is just great. And I guess my question is, do you find more and more younger physicians are open to that instead of having this sort of like Western medicine snobbery?
I certainly think...
Call for all the doctors.
Yeah. Well, you're not wrong. Listen, when I went to medical school in residency, they barely talked about nutrition. I had gastroenterology colleagues who didn't believe what you ate affected your gut. So, there was a lot of talk about siloing, there was a lot of that. And there was a lot of, arrogance and feelings of being threatened by people doing other things. And I, even when I entered medical school, I was aware that there was something missing. And I looked forward to learning the conventional modalities and then kind of embracing other things as I moved along my career. Young folks, well, there's certainly, first of all, there's more data around, the use of acupuncture and the role of nutrition and these kind of what was once considered kind of peripheral modalities. And so, science is science, and we want to use science as best as we can to drive our recommendations. So given that there is more science around some of these modalities, younger folks are being exposed to them more and more. And insurance companies are now paying for acupuncture, for example. So I think there's a broader perspective. And there's even an integrative medicine specialty and lifestyle medicine specialty. So more and more there's an awareness that how we live our lives, how we perceive our health and our body, where we are psychologically, imparts health, well-being, or illness. So you have to, if one is interested, looking at the whole person can be such a fulfilling and efficient way of helping someone feel better.
Right.
Yeah.
That's great. And Marybeth, as you were knocking on all these doors, did you find any of that attitude I was just talking of?
No, and I
That's
didn't
great.
knock on that many doors, to be honest. I wish I were as ambitious as your
As I
picture
think you
is
are.
painting. You're a gifted artist, and right now you're painting a beautiful picture of me
good. Thank you.
being much more ambitious than I am. No, I didn't knock on that many doors. I just sort of reached out to a handful of people who I sort of knew to be, as Amy has been known to be, open-minded, open-hearted, and willing to just chat.
So
for a few
you knew
minutes.
of Amy.
I knew of Amy, yes.
And did you have some idea that your work, health and wellness, was going to be sort of like focused on women?
Did I have an idea? You mean for myself?
Yeah.
And what I was working
for
on?
this new.
No, not particularly. I didn't really know which direction I was going to go in. As I mentioned, I had been working as a life coach as, kind of a side gig for many years. And I have several male clients who I've worked with for many years now. I'm really more interested, I would say, in midlife in general, being a midlifer myself. But now that I am going through perimenopause, potentially soon to be menopause, I'm not sure. These hot flashes, though, I'm having one right now. I'm very grateful for them this winter because it's the first time I deeply appreciate a good old-fashioned New York winter. Usually by now I'm moaning and groaning and I'm turning into a not so nice person. But this year I'm like, this is great. It's 0 degrees. I feel so much better going outside. Anyway, I know I'm totally digressing. But
No, that's good. Wait for it.
But yeah, I'm very interested in midlife. And I think, menopause and perimenopause, this time period for women is especially interesting to me because I'm going through it. And because I think for most women who have been running around, building careers, taking care of their families, taking care of whatever they've been working on for these past few decades, they probably haven't taken pause in a long time, like that little pun in there, and to really consider who they are, what they want, what makes them thrive, what domains of their life they have not been attending to, which might be then leading to illness or maybe not making them feel as energetic as they could feel. And I really believe that, we're all responsible for our own happiness. And this is part of that. And being in this stage of life, we have the opportunity to say, no, I'm not going to go through a midlife crisis. I want to go through a midlife awakening. I want to feel excited and joyful and energized and enthusiastic about what lies ahead. And I think that that's what has inspired me to really focus in on these particular topics and my peer group, frankly, of people who are going through this at the same time that I am.
Right.
Or around my age group.
Just amazing. Once again, I'm really super skeptical, but I'm just buying everything you're saying. I'm like, sign me up. Where do I send the check? It almost sounds.
I have a whole new idea for a project.
Oh, good.
Oh yeah.
Oh, yes.
Yes.
Good call.
I don't know
We
what
might have
that
a
means.
chairperson here too.
To those listening, I'm pointing to the men in the room.
Yes.
Oh, good.
Norm and Matty have a new side gig themselves.
Good.
Which is to sell the male side of this to the men in the community. Anyway, go ahead.
So you two were just a great couple, great business partners, I guess. Yeah. Me really passing notes before we went live, and now you're like making hands. Like seriously, Amy made I got an idea, made one hand gesture, and you're like, oh yeah, I get it. You were so totally on the same page as each other. What was the first meeting like? Where did that happen? And did you just
Bread alone, of course, right?
There's no other place to meet. Bread alone.
Yeah, we sat outside in the courtyard at
We
Bread
did.
Alone, and we started chatting, and we just really both are very passionate about these topics. So we just really, there was a great synergy as we discussed all of this, and I don't know which one of us was like, we really should try to do something together.
Yeah.
Because this would be really cool to bring our different but complementary areas of expertise to the table.
But this was your idea to find somebody, a physician, who you could work with together or learn from, or
learn from, I would say, and just have conversation with. It wasn't. I didn't kind of go into the conversation thinking, here's an agenda. It was more open to. I was open to a dialogue. What does the community need? What does the community want? How might I help people in some way? What are you looking to do with your new practice, Amy? What are you hoping to achieve with your podcast? What do you most want people to take away in terms of messaging?
The life coach stepping in, helping the health and wellness coach connect with the physician.
Totally.
It's like,
Sorry, just a bunch of papers.
so you all met. I guess it was this last fall or summer or something. You're outdoors in the back of Bread Alone.
Probably the summer.
It was
can't
the
remember.
summer, I think. Yeah,
I think it was definitely lovely out because we were outside. Yeah.
And it sounds like you all left there energized. Like, yeah, let's partner up and do this thing.
I did.
I did.
1,000%. Very inspired.
I'm going to ask Amy, what was your idea of what that thing was going to be?
Well, I knew it was going to be for and about women, for obvious reasons as a gynecologist, and again, it was an attempt to create something that addresses this midlife transition that is being discussed a lot right now. On social media, there's all kinds of influencers who are talking about the perimenopause and menopause. But quite frankly, there's also a lot of noise. There's a lot of misinformation. It's really hard for individual women to figure out, oh, wait, should I do that? Should I do that? Should I not do this? Should I not do this? Who should I listen to? So part of my inclination was to create an event that I could just kind of share some real information, real data, but to integrate it so that it wasn't kind of a boring lecture PowerPoint like, oh, your estradiol level is this, or, this is what you got to take. And I didn't want that. I've done that for a long time, and that's important information, but I wanted it to be more creative and fun, quite frankly. And after speaking to Marybeth, I realized, oh, we could do something that kind of integrates her work, my work, and just have a conversation that hopefully is with a group of women who are interested in, whether they're at the beginning of the conversation of like, oh, I'm starting to feel these hormonal changes and what's it going to feel like, or in the midst of it, or even done with it, and say, okay, how do I want to look at my life? Not just from a medical perspective of like, oh, what do I do if my vagina's dry? Not just that, but what does it feel like when my body's changing, and how do I integrate that feeling, perhaps even some grief or joy around those changes, so that I can just keep moving forward with understanding, knowledge, and pleasure and insight.
Right.
So we just, I don't know, Norm, you meet some people sometimes and you're just like, oh, I can talk to that woman. I can talk to that person. And other people, it's not so easy.
No, but I know each of you individually, you're both that way.
Oh,
like I just talk to this person forever and ever.
Thank you.
Feelings are mutual.
Yes,
you.
100%.
So you mentioned an event. Is there going to be something? Have you planned this already?
Yes, highly anticipated.
Indeed. So, and correct me if I have got it wrong.
No, you got it.
February 26th, so coming up from 7 to 9 p.m. at the Star Library here in Rhinebeck, New York, in person, a conversation called Change is Inevitable, Courage and Confidence Through Midlife Transitions. And basically what we're going to be doing is what we're doing today, this conversation where we're going to be integrating some medical information, medical concepts with wellness and life skills that allow you to continue moving forward in the most positive way.
Right.
So I'm not going to be giving medical advice. This is not for, these people. Hopefully all the women in the room are not going to be, clients at that juncture, but hopefully they will know that we can provide these services outside. We each have our own private practice, but really an opportunity to gather women together, to laugh, to cry, to ask questions. What my experience has been with talking to groups of women about this time in their life is that, well, just that. People laugh, they cry, they realize they're not alone in this journey, which can be very isolating, and they learn. And my feeling is any bit of knowledge is empowering and useful.
Right.
Yeah.
So this event sounds amazing. Let me just take care of some business here,
Sure.
which is if you want to get a ticket to this, it's estuarycoaching.com/packages. That's ESTUARY coaching.com /packages.
Correct.
Estuary Coaching being Mary Beth's life coach business.
Yes.
Estuary being what we live on here.
That's correct.
Not a river.
The river
A
that flows in
tidal
both
estuary.
directions. Yep.
Estuary Coaching. I love the name of it.
Thank you.
And tickets are limited. Is that right?
Correct.
And advanced registration is absolute necessity.
Yes.
And
Do it now.
honest God,
Do it
if
now.
anybody's listening tonight, that thing's going to sell out because you two are so wonderful and motivating.
Thank you.
And
Thank
yeah,
you.
seriously, as you're talking, I'm like, oh, I see them in a coliseum, just like
I
traveling
like
the world.
your vision.
Yeah.
Yeah.
Yeah, I think it's going to be very popular. So it's
Thank you.
7 to 9 this coming Thursday, February 26th at the Star Library.
Yes.
The 7 to 9, have you figured out how that's going to break out? Because I'm
Pretty much.
imagining you could do 8 hours of just Q&A.
Yeah. Do you want to
Well
review that?
said. Well said. Yeah, I'm going to do. I don't have my notes in front of me, so I can just. Maybe you do, Mary Beth. But basically, we're going to start with an introduction, and everybody's going to get an opportunity to say hello to one another, and then I'm going to do some basic kind of anatomy and physiology, like okay, what is going on here? What are the hormonal changes? And a lot of people already know this, so it's going to be a brief discussion of that. And then reviewing things that folks can do to empower themselves with language to ask the right questions, medicines, alternatives to pharmaceuticals, and basically introduce Mary Beth's and her way of looking at this life change as a part of, not an exception, but a part of figuring out how to be one's best during this time. So it's
Right.
not just about taking estrogen, but it's about looking at your life from a wellness perspective and understanding what else might be contributing to mood changes. It's not just hormones. What else might be contributing to sexual changes? It may not just be hormones. What else might be contributing to joint issues? I feel quite strongly that when we reduce all our symptoms to just hormones, we're really, it's a form of myopia. It's a way of telescoping in a way that I don't think enhances people's lives. I think hormones can be helpful, but you have to look at the whole picture.
Yeah, but people just want a pill. They just want to take the
They
quick fix.
do.
They
They
don't want to
do.
do the exercise. They don't want to do the life change.
They
They don't want to
do.
change their diet.
Some.
Some.
The others
Marybeth.
get excited, I think, about
Maybe.
having the opportunity to really reflect on what areas of their lives need attention.
With the
and what
right life
areas of
coach,
their-
they do.
Right? That's the hope, right? That they can align with someone and open up a dialogue and give themselves permission to do a deep dive and say, what are the areas of my life that might be impacting my health or that my doctor has suggested I sort of explore? And what action steps can I take to improve those areas of my life, enhance those areas of my life? What other action steps do I need to take to remove certain things from my life? If people are stressed and strung out and they're checking their phone until midnight and they're not getting any sleep, well, there are probably a few action steps that you can think of right off the top of your head right now that might support that person and help them reduce their stress levels, right? So I think that a lot of people just need permission and need the safe space to be able to reflect.
Also, I want to add
Yeah.
the other point is, and I think you would agree with me, that what we're talking about are not these huge, sweeping, global changes,
Right.
but just small steps. And they can be so important and so helpful. And, again, the small step may be saying, well, I really love that wine you brought, Mary Beth, but I'm only going to drink it on Friday and Saturday nights. I'm no longer going to drink it Monday through, the whole week long.
Right.
And that may be the only first step you make to help with your hot flushes.
Right.
Might be the only thing. And I would applaud you in that.
Right.
So if folks are listening to this, we're not talking about, well, maybe it's an abrupt change in your entire life, but for most of us, that's not what we're looking to do. It's about maybe I just need one small step.
Right.
That moves me in a different direction than I've been going. That's all.
Right.
Yeah.
Huh.
Go
Go
ahead.
on. No.
I was going to say, I just shared that with you, Norm. It's the wellness wheel,
I
which
see
is
this.
a tool for reflection,
Uh-huh.
which does cover the life domains. And you basically shade in on this wellness wheel where you think you are in each of these areas. And then by the end of the evening, the people who come to our event will hopefully walk out of there a little bit more clear on which areas sort of pop for them, whether that was rest and relaxation or fun and adding more fun factor in their lives, and some action steps. We're going to talk about, well, what can you do starting today? What can you do 3 months from now, 6 months from now, 9 months from now to live the kind of life that you want to live and be the person you want to be?
I love this thing more and more every minute that goes by. So this wellness wheel is something that every attendee at your presentation, your talk, is going to get. You're going to talk to them about it, and they're going to fill it out, and you're going to walk them through what their little action steps might be.
Well, it's a tool for self-discovery. So they have all the answers within, Norm. We're just here to facilitate conversation. That's it. Really, that's what a coach does, is opens the door for someone to really be honest with themselves.
Right.
And that's really what this is designed to do, is to open that door, to give someone a chance to think about those areas and to consider what action steps are reasonable and realistic, and when they want to make a commitment to activating on those action steps.
Right.
And then a coach is really there to support, motivate, and inspire, and sometimes hold someone to account if they want a coach who says, have you done that this week?
Right.
Depending on the style of the coach that they want to work with. And as Amy said, it could be something like, reducing alcohol intake. It could be something like, gosh, I want more social connection in my life, and I also want to do more community service work. Okay. Have you considered joining the Rotary Club, where you can get both, 2 for 1? Or I want to learn more. I want to be learning. I haven't been learning enough lately. I'm always either at the gym or at work. Okay, what about listening to a podcast when you're on the treadmill and learning that way, or reading a book at night before you go to... So again, these are little things. We're not looking to some people will move mountains, right? Some people will set a big goal for themselves and say, this is something I've really wanted to do. We've all had those things in our lives. And what do I need to do to make that a reality? And that's more of that longer term goal that can be aligned with any of these life domains or all of them. But yeah, this is really a tool to open up that conversation.
Amazing. And I wanted to ask this, I guess, Amy, as Marybeth describes sort of the coach's philosophy, helping people to get to their own realizations about what they need to do, that's not how physicians always work, where they're like, no, dude, the science is really clear. You need to do this. How do these two philosophies, it sounds right off the bat that it's a lovely pairing of yin and yang, but have you two butt heads as you discuss all this, or is it brand new?
Well, it's new for us.
Right.
But the old paradigm used to butt heads all the time.
Right.
For me, as I'm listening to Marybeth, I'm thinking, it's such a beautiful compliment to sitting someone down and saying, okay, you're telling me sleep is a real problem. And I'm thinking about it from a hormonal point of view, a sleep apnea point of view, perhaps an obesity point of view, kind of all these medical metrics that I'm going to try to sort through and assist this person in understanding, evaluate, and treat. But all that information only goes so far. Again, there's some people who, you give them information, you give them medication, and they're on it. They're just doing it, right?
Right.
But there's a lot of folks out there who start really well and then it dwindles off, or that they do it sometimes, or they don't have the language or the confidence to say to their doctor, you recommended that I do A, B, and C. Well, I can't do A, B, and C because I have no money, or I have no agency in all those things you've recommended I do. Whatever the reason is, there's obstacles along the way. So being able to look at it with a life coach, someone whose perspective is all about kind of teasing apart all these obstacles on this wellness wheel,
Right.
And then combine it with science, I think is the most efficacious way of taking care of someone. Not for everybody, but for many. Because, psychology, the mind and the body, they're connected, right?
Yeah.
And for so long, unless you were a psychiatrist, physicians, clinicians, they didn't think about the mind. They had no interest in the mind. It was separate. It was a whole separate science. We've done folks a real disservice because we know our mood, our emotion, our social status, all the things that affect our day-to-day affect how we feel and affect how we heal.
Oh, fun.
Yeah, very well said. Wow. So, have you done any of this before, the two of you?
No, this is our virgin trip.
Right. Could you possibly say that in a more sultry voice?
I can try.
Yeah, I'm really eager to see what comes next. There's so many questions. What are some of the questions that you all have going into this that you're eager to get the answers that this first experiment presents to you?
Questions. I guess for me, what do people most need and want from an experience like this? Are they looking for community and connection and being in a room with a lot of folks who are going through the same period of life?
Now, Amy said folks too, but it's women.
Women, yeah.
Right, okay.
Persons who identify as female.
Right.
Oh, okay.
So, I guess that would be my question. What is their why? What is their why for signing up and just trying to better understand what people most need and want? I mean, I know that for me, these types of tools are really helpful in clarifying what I want in my life. Thinking about mission and vision, not from a business standpoint, as a human. Who do we want to be on this earthly pilgrimage? We get 100 years if we drink Cannonau, maybe, right? Just kidding.
It is so yummy.
That's the red wine we're drinking.
According to the Blue Zones fans like me. But, you get this opportunity, right, to be whatever you want to be, to live in a way that you want to live. And I just think it's really fascinating to figure out and clarify what that looks like.
Right.
And then potentially, once you do that, you're more motivated to follow through on the advice that your doctor has given you about changing behaviors so that you can lower your blood pressure or lower your cholesterol or get the movement into your day that you need, because you're going to want to be healthier and more energetic for the years to come so that you can become all the things that you want to be. So I think that's where the coaching and medicine can come together too, is giving people that sense that they are empowered to figure out who and what they want to be and then take that advice so that they can optimize their own well-being.
Right. So let me ask you, Marybeth, you did all kinds of training as a life coach and as a health and wellness coach. And it sounds like it was, not insubstantial, the learning that you did. Which parts of those did you adopt quickly or over time in your own life?
Oh, in my own life, gosh. Well, probably a little bit of everything. Asking yourself I mean,
for those listening at home, I just rolled my eyes. I want specificity.
And thankfully, I've known Norm long enough that his eye rolls are perfectly fine with me. We actually played tennis many times, and I'm sure he was rolling his eyes when he turned around because I was terrible on the court, and he was awesome. That drop shot was legendary.
Still annoying
Norm.
people every day.
Oh, he has a legendary drop shot.
That's
Excellent.
funny.
Unbelievable. It always made me smile ear to ear because it would shock and surprise everybody. But he did it every time.
It made her smile because she doesn't give people the finger.
And I knew there was no way I was even going to try to run for it. In terms of what I've adopted, I just think one of the skills that you learn when you are going through these programs is active listening. And I've tried to apply that to my life. That is a very challenging skill to apply to day-to-day life. We're all very distracted by the ding-dongs on our phones and, you know, the running list of things we need to do. And active listening is really about being present and listening for understanding to the people who are sitting in front of you.
Right.
So I've tried to do that, but I will be the first to admit that as a human being, that is a very difficult, challenging
The human being in the
practice.
modern world.
Yes.
Exactly.
Yes.
Yeah. Huh. Well, same question, Amy. But what of the things that you've learned talking with Marybeth about what she does, which of those made you, smack yourself on the forehead and says, "Shit, I should do that," if any? But just don't say all of them, because I will roll my eyes again.
I think that what I've learned over the last year and a half since I left corporate medicine and started my own practice, and that has been supported and not necessarily spoken about between us, but what I think allowed for, in a way, the merging of the creation of a friendship, a creation of this project, hopefully many future projects, is spaciousness. Now, I know that sounds really weird, but let me explain a little bit more. As a physician, I worked basically from, 5:30 in the morning until 7:30 at night, and I've been doing that for 30 plus years. I mean, it's just, that's what my life was like. And I was good at it. I could do it. I was trained to do it. It was relentless, but that was the way life was. And I loved my work. So I did it with joy until it stopped being joyful. And this last year and a half has been unbelievably weird, because all of a sudden I'm not rushing to the operating room. I'm not rushing to the office. I'm doing something called a podcast, which gosh knows I never dreamed I'd ever do.
Right.
And so when I sat down to coffee with Marybeth, there was this sense of like, I have space to consider this. And I can say yay or nay. Mm-hmm. I can just say, oh, I like this woman, and maybe we'll just hang out and have coffee.
Right.
Or we'll do something professionally together. But there was this, I don't know if that I'm answering the question, but I think part of what I think Marybeth would say to me as my life coach is that I've just pivoted in a way that's allowed me to explore what I want, what I don't want. Space. I don't know how else to say it. It's really about time and space.
Right.
It's very metaphysical.
Well, it seems like you're very happy to be where you are now.
Oh, I'm thrilled.
And to not be where you were then.
I'm so grateful I could do that. I'm very fortunate.
Right. The good fortune and the luck and everything that we have to be able to pursue that can't be overstated.
Yep.
Wow. Okay. Oh, here's a question I had. So I wrote to like, I don't know, 20 women I knew. I just went down my text. I'm like, I know I barely know you, but I'm interviewing these people. Do you have any questions? And I got good questions, but here's the one that somebody sort of touched on. I want to ask you, because you really kind of, the two of you experts on perimenopause, menopause, and all the things that surround that. what would you want men to know about what women are going through?
Okay.
Yeah. They're speaking telepathically to each other right now.
There's, it's such a great question. It's such a great question. And it's, in a way, it dovetails to everything we've been talking about. We've been saying, listen, wellness is about everything. It's about medication. It's about exercise. It's about nutrition. It's about psychology. It's about changing one's life schedule. It's about all those things, right? But it's also about, if you have a partner who happens to be male, it's about what's going on between you two and him. Because I can remember, when I was going through the transition and I was sweating so much in the middle of the night that I was waking up, changing the sheets in our bed. We used to sleep in a small bed, then we got a king-size bed. That, my husband, who knew about the menopause, didn't know about the menopause until I was, ripping my clothes off in the middle of the night and changing my, it can be in a really abrupt shift in partnership. And so I'd want men. I'm already thinking that there's going to be a conversation. We have to have a conversation with men in this community about it, because it is so important. One, because the way women are feeling separate from their partners in terms of libido, in terms of these night sweats, in terms of sleep, in terms of responsibilities, in terms of, kind of everything globally. But what's going on with the men in our lives? They're suffering too. They're being challenged too. They're confused. They're going through their own hormonal changes and body changes and life changes. So I think it's great that we're talking about the menopause, that all these women are getting attention, but we also have to address men eventually too, but in a different way, not just in the traditional white male fashion.
Well, in what way? And back to the question, what is the one main thing you would want men or the people in your life? It could just be office workers who you're working with. What would you want them to know, or what would you recommend women who are going through menopause to let those people know?
It's real.
To clue them in.
It's real. It's medical. It's physiologic. It's not in our control. That hormones and life are causing for change. And I call it the, Dr. Jekyll and Mr. Hyde phenomenon, or the switch, that someone is turning on and off a switch that I have no control over.
Right.
And I need you to be patient with me because I'm trying to figure it out.
Right.
And it's hard.
That's good. And do people not think it's real? Do they think it's just,
I'm afraid
what's the word, histrionics?
Yeah, well, the etiology of hysteria.
Yeah.
So, and again, it's somewhat ignorant. It's there's a certain attitude towards women and their bodies. It's long-standing, centuries old, and whether it's misogyny or the patriarchy or lack of information, it's real. And moreover, to some degree, there's been so little information, even for women, about this time in their lives.
Right.
So there's a level of lack of education and ignorance that I don't blame anybody for. It's for so long we didn't study it. So it's a lot of things. It's a lot of things.
Would you ever have an event like the one you're having next Thursday for men?
We're nodding yes.
I think it's a great idea.
It's a fantastic idea.
And it's important for men to have this safe space where they can explore what they're going through, not just in the context of their wife or girlfriend or partner's menopause and all of that, but what they're going through as midlifers. And I think we just have to give each other space to really share openly.
Good words for living in general.
Yes.
That's right. That's right.
Yes.
That's right.
Amy, you mentioned somewhere at some point, people who identify as women. Mm-hmm. And that made me wonder, if you were a trans woman, born a boy, and you're doing whatever you're doing, maybe you have an operation, maybe you're taking hormone stuff, what kinds of change, and you're now 45 or 50, what kind of effects is that age going to have on you? I mean, is
not the same.
Is
Very
it called
different.
menopause?
Because those individuals will continue to take estrogen throughout their lives.
Right.
So they're not seeing the deficiency or diminishment of estrogen and progesterone that folks who are born female experience naturally.
Right.
But they are experiencing kind of a lot of other things, whether it's the social issues, the relationship issues, the concerns about heart disease risks, bone density risks, etc. So
Right.
it's different, but not so different that this conversation might not be helpful to them.
Right. And maybe more so, Marybeth's part of the conversation.
Yeah, yeah. Well, and remember, folks who have transitioned have done it in a varying degrees of extent.
Right.
There are folks who have had surgery and they have what we call neovaginas, and they are taking estrogen vaginally and systemically. And there are others who have not gone through that kind of surgery, for
Right.
example.
So it's going to affect people differently.
Yeah.
Depending on what you did or didn't do.
Yeah.
So many questions. I want to get to some of them. Somebody wrote in and said, do they have strategies for dealing with the embarrassment of suddenly flushing and pouring sweat in the middle of some important meeting or event?
Have fun with it. Let's be real, people. First of all, like I said, it does make for a much more pleasant winter if you live in the Northeast. But we have to laugh at ourselves. This is just part of being human, right?
Right. And, hopefully the people in the meeting, your fellow employees or whatever, understand these things that you want people to understand.
Well, most
and can
likely
roll with it.
Yeah, most likely they know someone who has experienced a hot flash in their presence at some point. That you're not the first, and you won't be the last.
Yeah.
Right?
Yeah.
I'm going to be a little bit more cynical. It's
Fair
not
enough.
always so easy.
No,
it's not always so easy. And for the individual who's perspiring like that, it's very distracting. So you're on a train of thought, and you're like you're hitting all the points you want to hit in the meeting, and all of a sudden you start sweating and feeling so hot that you're almost feeling nauseated and dizzy, distracted. That's the time to come see a clinician and say, hey, these hot flushes are interrupting the quality of my life, my capacity to work.
Right.
And everyone in the boardroom is male, and, they kind of get it, but they don't really, and not really being patient around it. So that's when, estrogen might be helpful, or some alternative to estrogen might be helpful, or there are adaptogens that can be helpful. There are interventions that can assist you so that you are not having those kind of flushes.
Okay. You brought estrogen up again. I got a lot of questions about hormone replacement therapies.
Yeah.
What do you think about those? You're no longer prescribing those?
Yes, I am.
Oh, you are? Mm-hmm. Okay. And a lot of people wrote about 20 years ago, there was some big pushback. Everybody's like, oh my God, we're going to get cancer if we take this. And so they all stopped. And now it seems like almost every woman I know is on HRT of one sort or another. What are the things to look for and hope for and to look out for?
That's a big question. We should have a whole podcast about that.
I'm done talking. So you take us out.
Take it from
6
there,
minutes
Amy.
to go. Yeah.
I mean, just to be really brief, so in 2002, the Women's Health Initiative was a very large study, multi-million-dollar, that was done with the intention of understanding cardiovascular disease in aging women and the effect of hormones on cardiovascular disease. It looked at mostly women who were in their mid-60s and beyond, so they were already a cohort of women who were at risk for heart disease, cancers, etc. And what they discovered within a few short years was that there was an increased risk of breast cancer, and so they stopped the study. The trouble is that since that time, the study has been looked at in many, many ways. The science was flawed in a lot of ways. and that the risks that we talked about, some were real and some were not, based on good science and the scientific method. And what the science now shows us, after all these years of more and more study, is that, for example, when estrogen is used vaginally, it's very safe and very effective for what's called the genital urinary syndrome of the menopause, which is the change in the vagina, the vulva, the bladder that women often complain about as they're transitioning through this time frame. In terms of systemic hormones, taking estrogen and progesterone still has risks, but certainly has benefits as well. And that looking at when you take it, so within the first 10 years after the last menstrual period, before 60, 65, depending upon people's family history, cardiac history, etc., that there may be some very real benefits and reasons that women should go on it. But the last thing I'd say is, should every woman be on menopause therapy? Absolutely not. It has to be a discussion between you and your clinician, because there are reasons to go on it and there are reasons not to be on it. Right. And there are different ways in which to take it, dosages, etc. So it's not a blanket statement. The trouble with 2002 is every publication said, go off HRT.
Right.
That's what we called it at the time. And it was a real disservice to women, because women suffered terribly because they went cold turkey and people felt terribly. Oof. Now we're saying everybody should be on it. Well, it's just the other end of the other bookend. And right. I'd say, please, like anything else, be cautious, be thoughtful, don't rush into it, have a conversation, understand it as best as you can for you as an individual, because we're all a bit different.
Right.
Yeah.
I love that. And I'm thinking about the services that you provide as part of this partnership. And, Amy says not everybody should do that, but almost everybody's going to be able to profit from your end of this business.
Yeah. I think we all benefit from having the space to share and to dream, right? Right. Think about when you're a little kid, people talk about childlike wonder. Where does some of that come from? It comes from the fact that people ask you questions like, what do you want to be when you grow up? Where do you want to live? What do you love to do? Along the way, people kind of stop asking those questions, and we stop asking them of ourselves. So I think any opportunity to engage in a safe dialogue where you can share or even ask yourself those questions again with someone really listening is a beautiful, beautiful thing. Right, for all of us as humans.
It's been beautiful for me listening to you two tonight. We're out of time. It always happens. It snuck up so quickly. Thank you both so much for being here. Marybeth Cale and Dr. Amy Novatt, who were hosting this thing. I want to come see. Men are invited, right?
Sure. Why not?
Why not? It's called Change is Inevitable, Courage and Confidence Through Midlife Transitions. And it's this coming Thursday, February 26th from 79 at the Star Library. It's $50 to get in, which, honest to God, is cheap, I think, for what you're going to get out of it. And if you want tickets, it's estuarycoaching.com/events.
/packages.
/packages,
Yeah,
okay.
close.
But hopefully if you go to estuarycoaching.com, you'll be able to find your way there.
Yes.
Everybody, thanks for tuning in. Thanks to Matt Rosenberg for running the boards, producer extraordinary. Thanks to Patricia Wind and the Epicurean for hosting. And thanks, everybody, for listening. Have a great Friday and a fabulous weekend.
Thank you for having me.
Thank you.
See, it was fun.